This episode of the Beauté by ABIC podcast is brought to you by the Aesthetic and Beauty Industry Council. Hello and welcome to the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauté by ABIC. I'm your host, Stephanie Miller, and today's guest is Dr. Irene Prantalos from Salubre. Dr. Irene understands the challenges associated with severe skin problems. In her teens and 20s, Irene, along with her mother, spent years trying to find a solution for her severe psoriasis. In her quest for a doctor who could help her, Irene found relief through Chinese medicine and took matters into her own hands. Having completed a double degree in human biology and Chinese medicine at RMIT, Irene completed a clinical internship at the Nanjing Teaching Hospital in China. Dr. Irene has seen many patients since opening her clinic in 2003. While Chinese medicine provided relief, Dr. Irene realized that it was essential to ease pain and discomfort in order to help the healing process when it came to skin problems. So in 2010, Salubre Cosmeceuticals was launched. The focus was on easing itchy, dry skin associated with psoriasis and eczema, but it also went on to help sufferers of acne and rosacea. A few years later, the Pro-Age Pearl Brilliance range was released, and it quickly became the most popular range of all. Her formulations combine Chinese herbal principles with peptide technology to achieve fast results. Here to discuss the impact of gut health on our skin from Salubre, today we welcome Dr. Irene Prantalos. Welcome to the podcast, Irene. How are you?
I'm good. How are you?
Super excited to talk to you today. We've got a good one. Whoever's listening today, we've got some incredible information on all things aesthetics and gut health. But before we launch into all of that, we've got a very special guest who is experienced in internal health and also skin concerns, quite profound skin concerns that I'm sure many of us can actually relate to. Before we get started, Irene, please tell us all about yourself and your journey into the aesthetics industry.
Well, thanks, Steph. Basically, it started with me having psoriasis. I was first diagnosed when I was 11 years old. And from 11 to 18, I kind of did the whole Western medicine route. I did the cortisone, like topical creams, and it just grew and would get worse to the point when I was in year 11, I was hospitalized for it. And then because it had covered my entire body. It was a very interesting experience to be in the hospital. I was actually in the cancer ward. So at the Royal Melbourne Hospital, they have one bed in the cancer ward. Two dermatology beds in the cancer ward. There was a girl with severe eczema in the other room. You would have thought they would have put us together, but I was in one of the rooms with three other cancer patients, and then she was in the other one. And the treatment protocol was pretty much, topical steroids, and I would do tar baths, and I did the UV treatment, the UVA and B. They don't do UVA anymore because they realized it was causing melanoma. My dermatologist did suggest I take Roaccutane. And my cousin was on Roaccutane for her acne, and I just said to her, "Oh, isn't that for acne?" And she said, "Yes, but we don't know what else to do with you." So it was very severe. But within a couple of weeks, with all that really intense treatment, it settled down a bit. So I was discharged and went, back to school. And then the following year, after my year 12 exams, it was really insane and bad again. And then I was in hospital at the Austin. I was in the children's ward then, and pretty similar protocol to the previous time, but they added methotrexate in. and methotrexate is an immunosuppressant. So I took that. I was taking 4 pills once a week. And I did that for a few months until the skin, psoriasis was coming back even while I was on it. And that's when my dermatologist kind of said, listen, we've got no treatment for you, so you need to go somewhere else. And it was devastating for me because I had put them on such a platform that these people are going to get me better, even though it had failed for 7 years prior. In my head, I was still committed to they're going to help me. And when they said they couldn't, it was such devastation. And I just remember bawling my eyes out. So we kind of fluffed around. My mum took me to a health farm and did little other things. And then about a year or so later, I tried Chinese medicine, and, the herbs were disgusting. I changed my diet around a bit. And within 2 months, my skin had cleared, which had never happened, first of all, over that period of time, but also so fast, like it never had relieved so long. So then I said to the doctor, I said, I need to learn about this because no one knows what to do with me. I was one of those real difficult cases, and I needed to take control of my own situation. I felt that everyone else had my destiny in their hands, and I hated it. I hated not being in control of my own life. So she said, RMIT are starting up a new course, and, just inquire with them. And I did, and I got in, and it started in 1995. So first year was a human biology degree, and then we gradually went into the Chinese medicine degree. So it's a double degree. So that's how I kind of fell into the whole Chinese medicine space.
That story is so just touching, but also there's so many elements to it that we could dive in. The taking control of your own sort of destiny, that part is a really resounding, I think, to everybody that's listening, as we all have elements of that in our lives. And we've all had experiences, I think, with the medical profession, which I respect very, very deeply, and I'm sure we all do. But also we know that there are limitations that we just don't know to science. And I'm sure that your doctors were just as frustrated, probably couldn't get their head around what was happening to you. But how heartbreaking that you were let go in such an abrupt way, and at such a young age must have shaped the way that you live your life and the way you tackle things right now.
Yeah. And, it was interesting. I was having this conversation with my husband last night, because I'm 48 now. So this is, 37 years ago when it all started. And I said to him, you know what, I actually feel like I'm finally in a place where I feel like I value my worth. When you're a teenager, you not only want to just blend in and be accepted by your peers, but when you've got a skin problem that people can see that you're struggling. And, there was a bit of bullying in year 7 to year 9 by one kid in particular, but everyone else was fine. But, it really impacts on what you think. And so many times I used to say to myself, can I kind of, trade this body in for another one? Because it was letting me down. And I thought, I was doing everything that the doctors told me, so disciplined, and it just getting worse and worse. And what I realized, that my body in particular does not like to be suppressed. So all the treatment protocols that I had for the first 7 years of that particular journey was focused on suppressing my immune system as opposed to dealing with the inflammation. And when I started refocusing and going, well, hang on a sec, okay, they say I can't cure this, but how about I avoid those things that seem to make it worse? So how about I change my diet? How about I change my emotions? How about I, try and keep my life in a way that's positive and not, stressful, or having friendships that are stressful, really trying to go, well, how about I just stop doing those things that seem to be making it worse? And that's when I sort of flipped the switch in my head and said, they don't know what my life is going to be about. So how dare they tell me I need to just accept it and live this life when I'm completely covered by disease? So I think there was a bit of defiance in me as well. And I think as well, my mum was a massive support. So her determination, and she would always say, we're going to find someone to help you. So I think with her, I had a lot of positive experiences in that journey as well.
It's so important to have such a strong role model, isn't it? And a lot of the times that someone in our lives has that impact, has that strength for us when we need it, and results in creating change for us. But what a story that you took control of your life and your own health, and you realize that at a very, very young age. A lot of people do go through life until later on, not realizing that they do have the power to take control of what does happen to them. And it's interesting that you something that you touched on, the emotional part of it, the stress part of it. Obviously, you're a Chinese medical practitioner, though you realize that it's not just about the supplementation and diet, it is also about the emotional element to it. Tell us a little bit about that area.
So that's a huge component as well. So that's one area that I think dermatologists and natural health practitioners do agree on with skin conditions like psoriasis, is that stress is a trigger, and obviously we get those inflammatory chemicals released when we're stressed. But the long-term stress can lead to what we call cortisol resistance, which then we talk about the adrenals, and then they're impacted to not work optimally. So here we are, stuck in this vicious cycle where we're stressed because of various circumstances, and even our health in itself can be stressful. When those organ systems don't work well, like in Chinese medicine, we relate the liver to be the major organ associated with anger and irritability and depression and sadness. So when the liver's not happy, it generates those emotions. And then those emotions will then upset the liver, and you get in this vicious cycle. And when you start recognizing that you need to nurture the liver, you need to recognize the adrenals component in the stress, then you feel more empowered. And I have patients that come all the time where they say they're stressed or they're not coping, they're feeling overwhelmed. And as soon as you start nurturing their body, and their circumstances don't actually change, and they tell me, I don't feel as overwhelmed and I feel like I can cope, and the stress has not actually changed, because you make the body work more efficiently. So there's a lot of components to managing stress and recognizing the impact it's having on our body as well.
Well, that's a really novel way of looking at it. Usually we are, let's disseminate and remove the stress, and then our body will feel better. But if you actually make your body stronger and able to cope with the stress, then the stress becomes less of a burden. And I think that's the catch-22 situation. It sounds like you deal with that in a holistic, more global way in your clinical practice. You actually deal with the stress with your patients. So that element is covered in your clinical practice as well?
Yeah, and also another component is trauma. So one of the massive contributing factors to looking at disease and gut health as well is what trauma a person has experienced or even witnessed. Trauma can be something we witness. It doesn't necessarily have to be something we've experienced. And delving into those sort of things is also a component of when I'm discussing health of a person, whether it's gut health or skin health or whatever it is.
Today we're talking about gut health, which is such an important, I think, we know how important it is, but it's still an underestimated and undertreated component of health and what we do in aesthetics, I believe. And you actually have a cosmeceutical skincare line called Salubre, beautiful name, by the way. And that is all associated with skin conditions, psoriasis and eczema. And you've also lately launched Pro-Age Pearl Brilliance, and this is a range within Salubre. And I'd love to touch on those just before we dive into the gut health. Can you tell us a little bit about those that skincare range and that particular range within it?
Yeah, so the skincare was launched in 2010, and that was really from conversations I had with my patients. So at that stage, I was practicing around 7 years. And, I ironically, when I finished practicing, everyone was like, when I finished my studies, they said, you will be treating skin problems and, you know exactly what it feels like. And I actually said, no, I don't want to. The last thing I want to be doing is treating skin problems. You know, skin problems had been my life for so many years. It's like I wanted a breather. And also when I first opened the doors, I did have people come in with psoriasis, and I would look at their skin and it would just take me back to when I was like that. And so I knew there was a fair amount of trauma there that I needed to resolve, so I can actually be objective when I see patients and not think about me, but look at them and what they need. So for the first couple of years, I actually didn't treat skin problems. And it's interesting how it works, because what was coming in was women's health and all that sort of stuff. And then after a couple of years, when I had worked on myself and gotten more confident with treating myself, then I started seeing a lot more skin problems, and, you know, widely from the anti-aging, acne, eczema, rosacea, psoriasis. And then I went and did an extra study in cosmetic acupuncture. And so when I was doing cosmetic acupuncture, people were asking me about, you know, what is it that I can use on my skin? I want it to be natural. I don't want any toxins. Obviously, that's the space people are at where they're coming to see me. They want a life that's free of toxins, and understanding the toxic buildup that can happen in a person's body. That was very important for me as well. And on a side note, my skin was always very reactive to skincare I tried. So I was kind of wanting to create something that I could use, because I had super sensitive skin, and then I could recommend to patients confidently, knowing that it wasn't going to upset their skin either. So that's how we came about doing the Salubre cosmeceuticals, and we did the anti-aging range. So, you know, as a practitioner, it's always about what does the patient need, and I'll create that. You don't necessarily think, when it becomes this big brand, how are you going to manage it? But it's all about what do I need to do to help my patients? And these are the patients I'm seeing. So these are the products I need to develop. So that's how the different ranges came about within the Salubre brand.
That's beautiful. You know, I speak to a lot of founders of skincare brands or cosmeceutical brands, and many of them who are actually the formulators and creators of have a similar journey. It's a personal journey towards, and a personal reason towards, creating that skincare brand. So kudos to you for doing something like that. It really, I'm sure, will empower a lot of people who have gone through your similar journey with psoriasis and with eczema and with, you know, those inflammatory skin conditions. It can be so challenging to use skincare and really look after the health and integrity of your skin, and, you know, help it to age gracefully and look smooth and beautiful when you're actually dealing with underlying skin health issues, apart from just the normal, you know, photo aging and the normal sort of aging processes that do occur. So that's wonderful to hear it's going so well as well, Irene. Let's go back to what we were talking about with regards to gut health. It's so fascinating. Tell us, we always talk about this term gut health, but what does gut health actually mean?
Well, I find sometimes when I hear people describe it, and they're really just describing a component of it. There are actually many components when we're talking about gut health. So we're talking about the digestive system. When it receives food, it breaks it down, sends the nutrients to the small intestine, sends the waste to the large intestine to be excreted. We're talking about gut microbiome. So there's various elements that can displace the good and bad bacteria in the gut, which can impact can cause dysbiosis and cause problems as far as skin microbiome as well. Then we're looking at the body's process of eliminating toxins. How is this system working so that we can eliminate toxins effectively through the kidneys and the bowel, the lymphatic system? Because if it's not being eliminated properly through those ways, it's going to come out through the skin, because we've got 5 ways of eliminating toxins. So when we're talking about gut health, it really is encompassing all of those elements.
The Aesthetic and Beauty Industry Council is Australia's peak industry body, representing the collective professional beauty and aesthetic, salon, clinic and spa community. Created for the industry, by the industry, our council is a collaboration of industry leaders who bring their commitment and specialised skills to raise industry standards, guide regulation, and be a strong voice to government. At ABIC, our purpose is to provide an accessible and supportive organisation for the betterment of the professional beauty and aesthetic field, to enhance working practices and promote unity across the various sectors of the industry. ABIC's mission also includes being a trusted source of referral, education and guidance for clients of the beauty and aesthetic profession. ABIC is here to support our members through an extensive offering, including hundreds of valuable resources, HR support and industry expert facilitators to ensure your continued growth and success. Join us today and together let's safeguard the future of the beauty and aesthetic industry. Find us at www.theabic.org.au. At ABIC, we are here for you.
And when we want to try and help our clients identify some issue with their gut health, there are certain questions we need to ask so we can identify which of those systems needs care. And, what is it that we can do to help them transition from perhaps an unhealthy state to a more healthier state, which would then inadvertently help them with their gut health.
Oh, it's so brilliant. And I love the fact that you outlined there's 5 elimination pathways. Let's go. Can you go through them really quickly for us?
Yes. So basically our liver has 2 phases of detoxification. In actual fact, the first phase creates a more toxic toxin. But the reason why it does that, it needs to create it water soluble so it can be eliminated through those different systems.
Right.
So from one element, we need to recognize we don't want the reabsorption of toxins, because what happens is we increase the toxic load and the pressure of the liver. But let's just say we've got a healthy liver, it's doing its job very effectively, then it will be getting rid of these toxins through the bowels, so through our stools, then through our kidneys, so through our urine. And then the lymphatic system actually collects those toxins and takes them out through those 2 systems as well, so the bowel and the kidneys. Now, let's just say someone's experiencing constipation. Well, their toxins are being reabsorbed because the stools are just kind of sitting around. The water's being taken out of the stool, which is causing it to become pebble-like or harder to pass. And then you're basically increasing that toxic load. So then if the body can't eliminate through that way, it will eliminate through the lungs, which we know carbon dioxide, and through our skin. So, when we're talking about improving someone's gut health, it's also leaky gut syndrome, and also the person's ability to clear toxins through their bowels is so important. And it's one thing I say to patients: do not do a detox if your stools aren't working properly, because, I'm constipated, I'll do a detox. No, that's just not the most smartest thing. Let's get your body working better first, and then we'll work on looking at how your body's eliminating toxins and see whether a detox is essential or not. So yeah, they're the sort of ways our body will naturally eliminate toxins.
Well, thank you very much for that detailed explanation. I definitely need to call you after this podcast. I think a lot of people are going to be asking for your number and trying to probably make their system work a little bit better in all areas. I think you've hit the nail on the head perfectly. And can we further go into that? What are I suppose, a few things that people can do to improve their gut health?
So one thing I wanted to mention, we talked about constipation, but the other one, I always talk about people's stools when they come in, like it's an essential question. But sometimes people say, oh yeah, I go to the toilet really well. I do a good cleanse. And I say, okay, well, what do you mean by that? And they'll say, well, everything comes out. And I'll say, okay, is it formed or is it broken? Is it loose? Oh, yeah, it's a bit loose, but it's good. I feel better. My tummy feels flatter after. And so if you're got loose stools where the stools aren't actually formed, you're losing your nutrients as well as your waste all in one hit. So everything you've eaten that could be so, organic and, biodynamic and really healthy is literally ending up in the toilet. So we have to know that what our body's ability to digest food is really important. And one thing people can do when they're looking at what could be the contributing factor is, hey, when I eat this food, my body seems to do this. When I do this activity, my body reacts in this way. So being aware of how their body is receiving that food and whether it's actually beneficial for them. Your head might say, I want to eat it. But if you have, sometimes cheese is one of those things that people will say to me, oh, when I ever eat cheese, I get loose stools or I get a reaction. That's basically the body saying, well, this is toxic, so we've got to get it out as quick as possible. And so recognizing how you react to the things you eat is a real good indicator that that's a place where you start. Doesn't mean you will never be able to eat it again, because if your gut health is poor, then you could be more reactive to foods. And so that's where we talk about allergies and food intolerances. And you can certainly reduce the food intolerance if you heal the gut problems. And then your body's more able to process that food. However, you might also have an intolerance for the long term, so you need to avoid it and then see how your body goes when you start consuming it again. So recognizing what you're eating, how your body's reacting to it, and keeping a food diary or a journal so that you can actually pinpoint what foods are irritating you within a 72-hour window. So it may not be instant, but it may be within that 72 hours is when we release those IgG antibodies, and you can have a reaction in that 72-hour window.
Oh, that's incredible. Have you ever seen anybody that has cured and improved their gut health and their allergies, not the food intolerances, but allergies have actually improved or gone away?
So depends what we're talking about, because there are some foods that are inflammatory and irritating. So when we talk about your sugar and dairy, gluten's been scientifically proven to increase inflammation. When we're increasing inflammation and we're irritating that lining in the small intestine, then we're allowing those unmetabolized toxins to enter the bloodstream, which would then instigate an allergic reaction or an intolerance reaction. But when we're talking about things like that are healthy, for instance, apples, or some people can't tolerate various vegetables. Sometimes people have those histamine reactions. You can definitely reduce people's histamine reactions to certain foods. So on one side, there's those foods that will be irritating just because that's how they're made. But on the other side, things that are healthy that your body's reacting to, you can certainly improve that resilience to those foods and reduce those allergic reactions.
Oh, that's wonderful to hear. I'm sure a lot of people out there who do have food intolerances will be quite relieved to hear that you can do something about it, at least the histamine component of it. And if not, then it's good to know to definitely avoid them. And I think there's an element of, in gut health, we were talking earlier, and leaky gut syndrome. Are they actually the same thing?
So leaky gut syndrome is a component of gut health, and leaky gut syndrome gives so many varied symptoms. So you may think, well, it's toxins, so it might be a skin reaction. Well, it could actually be emotional. Someone could be feeling depressed or anxious, and it's coming from their gut. It impacts their hormonal regulation and causes imbalance. So it doesn't necessarily just need to be skin related. But what happens is the lining of the small intestine is very selective as to what it allows to go into the bloodstream. But when it becomes irritated, and that can be from certain foods, stress, medications, recreational drugs or prescribed drugs, all those sort of things can irritate the lining of the small intestine. So what then happens is these toxins that shouldn't be entering the bloodstream do. And so the immune system recognizes this and starts attacking. And this is where we go into that world of autoimmune diseases, and we being trained to believe, oh, it's just the immune system reacting for no apparent reason. Well, I don't think our bodies were built like that. The systems that happen within our body are so measured and so specific that I don't think a whole immune system will start attacking itself for no apparent reason. Now, we can't see this under the microscope, or we can't do a test to recognize this. We can certainly do a stool test and see what's going on there, but the real indicator is the symptoms that are presenting. So that's really the proof that something's not going very well in the body. So when you start making key changes in a person's diet and various recommendations you do for their lifestyle, and then you can give them herbal medicine to help, then you can definitely restore that leaky gut component. But people need to understand that what got them there can get them there again if they choose to go down that path. So it's really about healing the body, but also informing and educating the person to go, well, this is what got you there. It is ideal for you to be avoiding this sort of stuff in excess. It doesn't mean you can never have it again, but you wouldn't be having it on a daily basis, multiple times a day, if it's causing this sort of reaction in your body.
Wow. Dr. Irene, what are the 3 things that we can start doing today to move towards a healthier gut state?
So I think definitely recognizing any reactions we have with our diet and looking at eliminating foods that create illness. So that would be, like I said before, your dairy, your gluten, sugar. And this is the thing, like when we talk about sugar is sugar. We've got now, if you go to I know when I go to my local organic store, right, you go to the sugar aisle and you've got monk fruit, you've got coconut sugar, you've got apple concentrate, rice syrup. Like there are multiple. And so you think, oh, that's good. That's from coconut, so that should be okay. But sugar is sugar. So the body's going to receive it the same way. So if you've got an inflammatory skin condition, and let's just say acne, right? So we've got, bacteria in the skin, which feeds off sugar. Well, you shouldn't be having any of that sugar. So avoiding things that are going to create more inflammation in the skin, avoiding things that are going to disrupt the healthy absorption of nutrients in your gut, and recognizing what those foods may be, and not necessarily having an emotional connection to it. And that's the thing where we get into emotional eating versus, feeding our body the nutrients it needs to function at its optimal. And that's what I really had to recognize in my journey, is that, I used to eat lots of sugar and cakes and pies and all those sort of things when I was, and it just didn't serve me. And for me, I'd rather have a skin that's healthy and I can wear a t-shirt and feel freedom versus eating something and then I get a terrible reaction. So empowering a person through their diet is something that I'm very passionate about. Secondly, you definitely want to recognize where your stress levels are coming from. And are you stressing for the sake of stressing? We have to remember that when our body gets into a stress state, our body thinks we're going to be either chased by a lion or someone, a predator, is going to come after us in an alleyway. It's not because I spoke to my friend the other day and she was a bit rude and abrupt to me. You know what I mean? Like, we need to put things into perspective. And if we have got friendships or relationships that aren't healthy for us, we need to recognize that. And really changing the way we perceive our environment is important to create that optimal calm and relaxation. So, self-awareness is a first step. And then self-regulation is the second step. So waking up and giving yourself that assessment. How am I feeling today? What do I feel I need? What is it that I need to do to make myself feel whatever ideal way I want to feel? Regularly doing your quick meditations during the day. It could be 5, 7, 10 minutes. That's all it needs to be, where you calm the nervous system, and you'll find you'll be more productive for the rest of the day versus getting into this stress state and being a headless chook and running around and doing all these sort of things. Just literally taking 5 to 10 minutes out will calm the nervous system and allow your body to be more switched on and more receptive to what you need to do for the second part of the day. And finally, really understanding what areas of your gut health needs to be addressed. And this is where, this is something obviously you can tell I've got a huge passion for. And this is what we've worked with alongside our stockists, because whenever I treat my patients, I want them to get resolution. And I think when you are able to help your clients, people listening to us that are in the beauty industry, whether it be in the beauty or dermal space, they want to help their clients out as much as possible. Not obviously from the perspective of this is humanity and we're here to serve and we're here to help people, but also it helps with the business and it helps with client retention and it helps with, word of mouth and creating that business structure where you're building and helping more and more people. So we work alongside our stockists and provide a free service where, we help with identifying where the gut health issues are coming from and also help with recommending which products is best for their skin, because we also do have an organic herbal tea range, which we can recommend people to take that work on gut health or adrenals or leaky gut syndrome. So we've got those components available as well. So recognizing what part of the gut needs that assistance and finding tools to help repair that area.
Wow, blown away. Dr. Irene, you are incredible. Before we wrap up the podcast, please tell us, do you still see patients?
I do Zoom as well. So we're in Baronia in Victoria, and we're actually, the clinic has just moved since October 2022. We've moved to the head office. So we've got the warehouse in the back and we've got the clinic in the front. I do a lot of Zoom. I do patients, even people that are in Victoria that don't want to travel, they often will do Zoom consults. So we've got a combination of in-person, in-clinic and Zoom as well.
That's incredible. Obviously, that you have such a successful business, skincare line, and you still take the time to see people and help people improve their lives and improve their health. Honestly, it's a credit to you. Thank you so much, Dr. Irene, for coming and talking to us and enlightening us. I've learned so much today, as I'm sure all of our listeners have. And please do come back and give us a follow-up. We'd love to hear from you again.
Thank you. Thanks, Steph. Thanks for your time. It's been great.
You've reached the end of another episode of the Beauty by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.